People could quite seriously like roll in on a Monday and go home on Tuesday, and then their depression will just get better. The truth of the matter is an absurd number of my colleagues are still just slinging drugs all day. If I'm trying to stimulate a brain to make it work better, I don't really think that's possible if the brain can't really get enough fuel. If you're a psychiatrist and you don't pay attention to someone's metabolic health, then I don't think you're being a doctor. If your insulin's not right and your fuel system's not right, then there's no logical way that the brain can be right.
Will, how are you doing today? Good to see you again.
I'm great. It's good to see you.
Yeah, likewise. Are you still in, I believe, Virginia? Correct if I'm wrong on that.
I'm in Virginia, but I left Richmond.
So what does that mean for you?
Well, what it originally meant is that I sucked up about 100-mile commute to go cover TMS treatments in Richmond. But since then I left my company, Greenbrook, and got a whole new job, whole new life, and it enables me. This is my office now, where I'm sitting, right upstairs in my house.
You said you left the one position. You've got a new sort of, I guess, vocation or job, I guess. So tell me about that. What's going on with that?
I warned that I wanted to ask some questions about Revero, and this is pertinent to that. So we'll start there.
Okay.
But
sure.
I left. So the company Greenbrook, my company that I think we have talked about before, and that mainly a TMS company, but we took on esketamine about 3 years ago. That the really short version of that story is that the company Greenbrook, the clinics, were purchased by the device manufacturer. So that, for a lot of reasons, most of them probably being not doing so great financially. And I didn't really want to work for a device manufacturer, so I left that company. And that was back in, it was November when I put in my notice. And I live out here in Stanton, Virginia. I had a contract in hand to go work at the hospital that's 12 miles away from my house. It was going to be this like inpatient psychiatry job, 7 days on, 7 days off, probably boring as all heck. But it was, pay the bills, take a breath, kind of figure out like what I want to do, post Greenbrook. And then out of nowhere, I get a phone call from this company called Osmind. And don't know if you've ever heard of them, and you probably wouldn't have. It's a 5-year-old startup company that is a electronic health record built from the ground up for psychiatrists. So straight up like standalone EMR, but imagine an electronic health record that actually has all the built-in templates to be doing like TMS treatments, psychiatric interview, all your normal psychiatric care, plus interventional care, ketamine. Actually, all the original customers of Osmind were ketamine docs. That was kind of how they got their start. And so 5 years later, I think a friend of a friend told somebody that I was free. And they gave me a call, and surprise in my life, they hired me to be their chief medical officer. So I've been the CMO of this like startup tech company that's headquartered in San Francisco, like since January was when I started there. So we'll still say it's about 30 seconds, but imagine an EMR. We are now building it. This is 100% public now. We're building it into a full suite, like revenue cycle management, credentialing, everything. So like basically a psychiatrist could now use Osmind to be their 100% practice solution. You could be an independent doc, hang out your shingle, take on Osmind and everything you need. You're not going to need a billing company. You're not going to need credentialing help. It's like Osmind will do all that. It also has greater than 50 built-in like psychiatric measures. So think like standard things like a PHQ-9 scale for depression, MADRS, Hamilton rating scales, anxiety rating scales, PTSD rating scales, so that it's what we call a learning health system. Any psychiatrist, nurse practitioner that's using Osmind can be pushing all these measures out to their patients as often as they please. Their patients can fill out a PHQ-9 on the app. So right now for PTSD, there's the whole patient base of Osmind is probably about 250,000 people spread out among 800 clinics. And out of that, we have about 75,000 completed PCL5s for PTSD, like sitting in the system right now. So in terms of machine learning, it's like we have the ability to take that information, run just about any kind of study you want, looking into what I think all the cool kids in the business are now calling real world evidence.
Yeah, that's really nice. Yeah, and I think I like that aspect of the real world, because we see a lot of often pharma-sponsored RCTs, and it's really contrived. It's not like, it doesn't often translate into the real world. And then as clinicians, we see what these the drug-funded studies show. We don't actually see them practice in the same way that it's supposed to work in the thing, and then we just kind of chalk it up to, oh, that person's an exception, except those exceptions just happen over and over again. And so,
right, when the exception is the rule.
Yeah. Well, let me, just for those who have not heard, because not everybody remembers this stuff, the TMS, remind folks what TMS is about.
Transcranial Magnetic Stimulation, right? So that, where, like, to really grossly oversimplify, you can use an electromagnetic field that's about 1.5, maybe 2 Tesla. So on the order of, what would you say about the most garden variety MRI there is? 1.5, 2-ish Tesla. But the field on a TMS machine is going to be about the size of a golf ball, as opposed to a typical MRI. And by switching that on and off, you can electrically stimulate brain. So that you use a TMS field to electrically stimulate brain tissue, generally down to about 1 inch below the skull. And then TMS was FDA approved for depression in 2008, and that specifically involves stimulating the left prefrontal cortex at a frequency that would generally make that part of the brain more active. And for time immemorial, the antidepressant effect has been attributed to that. There's more to it than that. It's generally regarded to induce neuroplasticity, so your brain is better at growing and learning, like, through the entire course of TMS treatment. And in fact, to that end, I've had great results with depression in the context of brain injury. And I would argue that it's for that reason, that it isn't just that we're treating depression, we're actually inducing the brain to grow and heal. And one of these days we'll be able to prove healing in what way, because I don't think anybody knows that right now. But that's the basics of TMS. What's kind of amazing, every time we've talked about it, and since 2008, TMS treatment has been 5 days a week for 6 weeks, right? So you do 30 treatments. It's not horrible. It's 20 minutes of treatment a day. People can drive themselves to and from. There isn't really any recovery. It's not the end of the world. But maybe 2 months ago, tops, there's a guy in Toronto. His name is Dr. Jonathan Downer, which is pretty hilarious that a depression specialist is Dr. Downer, but he's got a sense of humor about it. He published a paper showing that you can do TMS for a 3-minute treatment every 30 minutes for 10 hours. So it's 20 treatments in one day. But he combined that with a tiny little dose of D-cycloserine, and he combined it with a tiny little dose of lisdexamphetamine, Vyvanse. And this 1-day treatment protocol plus those 2 little drugs to induce neuroplasticity, and something like 80+% of his initial run of patients all got better.
Wow, that's pretty impressive.
It's like if it becomes more of a real thing, it changes the entire business, right? Like that, because for more than 15 years, if you get TMS, you got to come every day for 6 weeks. And this is now a potential, like, people could quite seriously, like, roll in on a Monday and go home on Tuesday, and then their depression will just get better.
Yeah, I can't imagine you're not aware of this. I mean, I think I'm definitely sure you are, but I mean, given that, you obviously you've done carnivore stuff, you're obviously in psychiatry, you're probably aware of some of the metabolic psychiatry stuff that has been becoming more and more popular through some of the other, Chris Palmer, Georgia Ede, the Bazooki Foundation, some of the other folks that have been putting some money into this, funding some clinical trials. We're seeing kind of a revolution in psychiatry. At least it seems to be. I don't know what the general psychiatric profession thinks of this, or it's still maybe outliers. But how do you see, I mean, obviously you could combine TMS and metabolic psychiatry, maybe even with even better results, I'm guessing. What are your thoughts around that new development, so to speak.
It's like you can't imagine how excited I am about it. Which pertinent to that, I'm extremely pleased to say I think I got a date on the calendar to chit chat with Chris Palmer next week. So, and he's starting his own thing in Boston, like I think a dedicated like multidisciplinary metabolic psychiatry clinic. That I'll ask him for clarification, but I think it's meant to be him, not McLean. So he's going to be like, separate from Harvard, like kind of pursuing his own thing, though I'm sure it'll still be affiliated. But
I'm wondering what the general, I mean, obviously there's academic politics and maybe they're constraining his ability to do that, or if he feels like, I'm not sure. I mean, I don't know what's going on. Maybe you have insight into that, but, hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Well, just the most benign possible explanation that I would set out there, but I'll be excited to ask him about it. When you're in an academic environment, I mean, were you ever in an academic environment outside of the Air Force?
Sort of peripherally. I was attached to the University of New Mexico a little bit. I kind of taught the residents for a while. Just as kind of a adjunctive role. But I was also active duty in the Air Force at the same time, but never like full time. But I did do some.
Yeah, because I just think we had it a little bit different in the military. Like I was faculty at Naval Medical Center San Diego, right? So technically I did academic time, but I don't think it's quite the same if you're at a place like Harvard. But some of it is just, when you're in the academic environment, there was a guy at VCU who was the brain stimulation guy at VCU in Richmond, and he used to send me TMS patients all the time. Like I couldn't understand why he referred so many patients to me when I knew darn well he had his own chair and he's literally the TMS guy at VCU. And I finally got to ask him one day and he's like, "Will, I'm in an academic environment. They won't let me work past 4." So it's like people would come to him wanting TMS, and the minute they started talking about like wanting to come for treatments after work, he would just give them my card. Because he's like, "Hey man, you got to go see this private guy because he'll treat you at 6:00 at night. He's got parking. He'll do this. He'll do that. Like in other words, all those things were easy outside of the academic environment. I wouldn't be surprised if like Chris would just say that he probably can't see the volume of patients like inside Harvard that he can if he's outside Harvard. I'd be half tempted to say it's just that simple."
Okay. Yeah. I mean, I don't know if you spend any time working at and with VA hospitals. I mean, I did some, and that was one of the more frustrating things. So they were so inefficient and so slow. Yeah. I mean, it was like dropping from 5th gear down to 1st gear. I was like, you couldn't get anything done. I mean, I don't know.
Yeah, I've never been on the inside. I had enough experience when I was on active duty to know I never wanted to go inside those walls.
Yeah, I mean, the VA, it just seemed like everybody was there. It was kind of like the roadies, the retired on active duty people. They're biding their time and collecting a paycheck and doing the minimum that they could. And it was just like, it was extremely frustrating for me as a surgeon because I was like, I could literally on a very good day do 2 surgeries on a day. And when, in a private setting, you could do 6, 7 surgeries, and there you're doing 2. And it was just like,
yeah, exactly.
It was
exactly. Like guys like us, you just want to work, right? Mm-hmm. Like I want to do what I do. I want to crank out good work, get people better. And it's like freaking back off and let me do it.
So, because I think, both of us have an Air Force background. Both of us have, switched our nutritional philosophy. Both of us like to work out. Are you still training pretty hard? How's your that stuff going?
Yeah, I'm with the move to Stanton, I basically retired from crew, right? So no more, the closest place I could row would be Charlottesville. And I'm not getting up at 4 a.m, so I can be in Charlottesville by 5. So I'm pretty much 100% on the weights in my garage now, so that Your training's pretty awesome. I'm not doing nearly as much like speed work as you're doing, but deadlifting, swinging kettlebells, basically getting as big and strong as I can possibly get.
Yeah, I'm actually on the way down a little bit. Like I got pretty darn big and strong, and walking around at 260, 270 for the last 3 or 4 years, and I'm like, now I want to focus on being able to dunk basketballs and run real fast. So I have to peel some of that weight off of me, and so I'm down. I think it was 243 this morning, so I'm coming down quite nicely. And I had my first session with a track coach last night at the track, and so that was good. So it's like, I'm looking forward to this. It's a new venture for me, trying to get good at a different sport, because it's always fun, because you kind of get obsessed about something new, and you can see improvement pretty quickly, which is really cool. Because it's like for instance, rowing, I can't get much better. I'm already probably as good as I'll ever be, and I can certainly, relative to my age, continue to do quite well, but. So I'll still do that when I turn 60. I'll go after some of the Concept 2 records again, just as a 60-year-old. But for now, I'm trying to working on the sprinting stuff, and it's been fun. It's been light. It was kind of interesting. I reached out to another coach, and just kind of gave him a little overview of what I wanted to do and where I'm at. And he basically said, "I suggest you find another coach because your goals are unrealistic." And I was like. And I'm not that far off of them already. I'm like, I'm not that far away right now. But he was just like, yeah, they're unrealistic for a 60-year-old, because they're decently asked. They're not world record level, but they're decent. They're competitive level. And so I just said, thank you for the motivation, dude. I mean, I just basically wrote him. I said, thank you for the motivation, and it just pissed me off. So I'm like, so now I'm doubling down on that. I'm like, I'm definitely going to do it now, just because. This bozo said I can't.
Here we are, and the camera is what it is, but you look like you're getting fast. I've seen.
Yeah, I mean, I'm hitting 18 miles an hour right now. So I mean, that's legitimately. I mean, for 60 or almost 60, that's fast. For it's like it would be kind of a slowish high school track athlete. I mean, you start hitting over 20, and then you're kind of fast, and then obviously the top end guys are 24 miles an hour, and then Usain Bolt's running 27. He hit 27.8 when he ran his 9.58. So, but I mean, I'm getting there. I'm getting there, and I'm having fun with it. And the nicest thing is, I've gotten to the point. I've reached that point where I don't feel like I'm going to get hurt. So now I feel like I'm comfortable hitting max velocity, and I don't feel like I'm going to pull a hamstring or pull a quad. Everything feels good. So that's a really nice thing to really reach that. Because initially it was kind of like dicey. It was like. And my understanding is the more you do it, the less likely you are to get hurt, because your muscles are used to it. They're just like used to the demands. And if you do it just one off from time to time, that's when you pop a hammy or something like that. So I'm usually out there on the track at least twice a week, running as fast as I possibly can, with spikes on, and timing myself, and trying to make those improvements. So
I think I learned that. Is it Keith Barr? Do you remember his name?
Yeah, he's a researcher out in California. He does. I interviewed him several years ago. Yeah,
I think he's the guy from which I learned that. Like, he talked about baseball players that are resting in the off season, and then they go out and throw on the first day, and it's like their muscle's strong, but the tendon's not, and that's when. Like, to your points, like, that's when you get hurt, because they're not.
When you have your UCL procedure, your Tommy John surgery or something. Yeah, it's I mean, it's and again, as because I can't, because you're somewhere close to me in age. I think you're in your 50s, if I'm not mistaken. Correct?
I'm 50 exactly.
You're 50 exactly. All right, so I've got you by 8.5 years, I guess. Yeah, I mean, it's doubly important. You don't want to let that stuff go. You got to stay after it. You got to keep hitting it, and you got to keep because if you take a lot of time off, it's a bigger slog to get back there. So I try not to. Even when I'm like, on the road traveling, like I was, I brought my running stuff, and I just go out there, and it's easier. The nice thing is easier to run and jump, because you don't need any equipment. Basically, you can just,
right.
I was jump around in my hotel room and piss off the people down below, maybe, but yeah, doing some of that. So it's been fun to do that. So dietary wise, you're still carnivorish. Is that fair to say, or no?
Yeah, carnivorish. I'll full integrity. I'll say greater than 90%.
Mm-hmm.
If we had to put a number on it. So there's maybe just the tiniest little handful of fruit or some kind of dessert. Can live in our diets. Both Meg and I are, basically on the same program, and maybe just a little bit of honey. Never more than what would be about 20 grams of the glucose, fructose content, and
Yeah.
everything else is meat and eggs. Lately, just by virtue of where I live, there a lot of days go by I don't eat anything but eggs because I'm kind of covered up in eggs and I'm trying to eat them.
So yeah, and I've it's kind of interesting. I don't know. There's this sort of quote unquote sugar diet that's now become somewhat
Yeah.
popular, and it's basically you look into the mechanisms by which that supposedly works, and they talk about this fibroblast growth factor 21, which occurs basically. There's several things that drive that. The most powerful stimulator of that is really low protein because your body literally thinks you're starving. And so I said, well, I believe that, if I just do a very low protein diet for a couple of days, I'll lose weight. And sure enough, I dropped 8 pounds in 3 days just by reducing my protein down to nothing. Now, that's not a long-term solution because
Right.
obviously long-term chronic protein deficiency equals kwashiorkor. This is what these starving African children end up like. So it's not a good thing. And kids particularly are affected because they're in such a high growth phase. And so with adults, you see kind of what happens to a lot of fruitarians. They just get really, really thin. They get really, really thin and because of the chronic protein deficiency. So it's not something that you'd want to do for a long period of time. But like I said, I went from 250 to 242 in 3 days. And I ate basically, my diet consisted of egg yolks, cream, and butter for 3 days. That was it. I fashioned those ingredients and mixed them together in various ways. I made like scrambled egg yolks, which is actually quite good, but it's incredibly dense. It's like, wow, it's like really rich and dense. And I made these brown butter bite things, and I actually made a little ice cream. I just froze egg yolks and cream together. And I put a little vanilla in there just for a little taste. But yeah, I mean that worked. But I mean, I missed the protein. I was like, man, I want a steak.
Yeah, you need some real food.
I was looking forward to real food, some actual protein in there. So, so you live, like you said, you're down the street from Joel Salatin. Do you ever interact with him? Have you been to his farm? Have you bought any of his meat, or what's the deal like?
I haven't been a good neighbor. I've been out there once because I needed to make the pilgrimage. I've not yet gotten to meet him, but I bought a bunch of stuff in his store. And I can say that his beef was not my favorite. Mm-hmm. Like I'd eat it, but it's probably not my fave. But I'd say the chicken and the pork I'm delighted. And actually I've been, I think Meg and I have been talking about like maybe eating some more chicken once in a while. And I really want to go out there and buy his chicken because I'm happy to eat chicken, but I don't want to eat chicken that's never seen the sun.
Yeah, the battery raised chicken, which so much of it is, the broiler chickens. So your chickens are all egg layers. You don't have any like any broiler type chickens.
No, we haven't gotten into meat chickens.
Yeah, interesting. And so any because you got 35 acres, I don't know how much of it is cleared. I mean, could you stick some cows on there if you wanted, or sheep or something like that?
Thanks for asking. I failed to mention that. I have like my big pasture, probably like a good 15 acres or so, like the real pasture in the place. It does have cattle on it, and they're the most wonderful kind of cattle you could ever have. They're called Not My Cattle.
So you're renting it out to someone else, basically.
Yeah, there's this wonderful rancher, and he rents pasture from quite a few of my neighbors. And this place where I live is part of years and years ago, it was a 600-acre property that was primarily an apple orchard, and the family sold apples to the government in World War II. Mm. So it's like kind of got a little history of it, this like beautiful little valley within the valley. And it's been subdivided up now, and there's multiple between 30 probably and 50-acre plots. And that rancher, I think he rents pasture from at least 3 or 4 people around here. So the cattle are kind of rotating around the whole property all year long. And of course, the best part is that in Virginia, it meets criteria to make all of our properties agricultural because we're
Yeah,
all
there's tax advantages for being a farm, basically, I guess.
massive tax advantages. And
Yeah.
in Virginia, you have to make money. So that's the way they do it. It's like the rancher pays me a pittance because I don't really want his money. I just want the agricultural designation. So he pays me and all my neighbors the minimum that it takes to like meet that standard in Virginia
Okay.
that
To check that
we're an
box. Yeah.
agricultural business. But
Yeah.
but of course, with respect to Joel, I'm most happy that my grass is being eaten. Right? It's like the cows are out there and they're eating and they're pooping and they're improving the soil and they look nice and that land's not going to waste. And
You guys
that's
got a
the
bunch of, probably a lot of, like you said, coyotes, probably some deer running around. Maybe, I don't know if you have bear issues with bears out there.
there's there's black bear up in the hills that almost never bother anybody. So
Mhm.
our black bear are clearly happy up in the hills. They don't maybe once in 10 years I think a neighbor has seen a bear that came down. So I'd say it's exquisitely rare that the bears are desperate enough that they'll come mess with people things. We're covered up in deer. So
Yeah.
the deer are around, they're very, very healthy. A couple of my neighbors hunt them once in a while. So they're almost always someone in my neighborhood's got some venison cooking. So we have access to that now and again.
Yeah, I've had a bear. We've got some bear around us, and actually over the last 2 weeks, a bear got into our trash. I look in there, and trash is like run all over the yard and drug up the hill, and I had to go. My daughters were grossed out. They had to help me clean up the trash. I was like, sorry, the bear. So I stuck it in. I had to lock it up inside a shed. But yeah. So let me ask, because you said you weren't a big fan of Joel's meat. Was it too lean, or what was a major concern around it?
It was probably a little bit lean. And
Yeah.
then I haven't had a chance to ask him about it, but I have another buddy who raises beef out here. Like he's a little further west than Joe, but he's still in Virginia. And his beef, both of like Joel's beef to me, I don't, nothing against Joel and my buddy. I find that it tastes just a tiny bit fishy, which I've read. The suggestion is that there's almost too much omega-3.
Yeah. Yeah.
Like it, and it's I don't know if it's because it's so grass fed. Like, have we overdone it with the grass fed? Or my other buddy, I know he supplements his beef with some omega-3. Like he gives him a little bit of omega-3 feed because he thinks that's a good thing. And I'm kind of trying to find a nice way to tell him like maybe a little less on the supplement. It's making the beef taste a little fishy. So
Yeah,
it's like,
I remember I met a guy who promoted his omega-3 beef, and he basically said it tastes like fish. And I was like, well,
yeah, yeah, it's like
good luck selling that. I mean, there's, if I want
I
fish, I'll eat
know.
fish, right? Yeah.
I'll eat it when the apocalypse comes. It's like
Mhm.
trust me, I think it's fine. It's fine to eat, but yeah, it just doesn't taste very nice. And so I'd eat just about anything but.
Yeah. But what's good? Oh, I like the pork and the chicken sound pretty good though.
Oh yeah.
Um,
Did you see the documentary about Joel? Speaking of which,
I interviewed Joel years ago, and I've seen a lot of his stuff. I don't know. He's probably been part of a few documentaries. I'm thinking. I think he was part of Food Inc. and some other ones, but I don't know which one specifically you're talking about.
most recent one is on that Angel Studios, and it's about an hour, and it's within the last few months. So it's
I have
pretty
not. I have not seen it. Then no.
easy to find, pretty new, but that to the pigs especially, because in this documentary he was talking about his pork and his pigs, and my buddy's pigs are the same way. Like they basically live in the woods, and that I would like. I mean, not only am I really, really happy with the way they were raised and the health of the meat and everything about it, I have never had pork that tastes that good. I mean, it is like a pig that really truly lives 100% forage, and they're happy and they live their life and they're having fun rooting around in the trees and just doing their pig thing all the time. It's like, oh my God, that is like, I think anybody would eat that and never go back because it's just such a better, more satisfying kind of pork.
Yeah, I think when I was in Hungary, like last fall, they had something. Some of the pigs are in a similar way. It's specific. I can't remember
Hmm.
the Mangalese or something like that. I can't remember the exact breed, but yeah, I interviewed a guy named Greg Gunthorpe a while ago. I think he's in Illinois, and he's raising them similar. And I was in when I was in Tennessee. They have this place called Lick Skittle Ranch or Farm.
Hmm.
Lick Skillet Ranch or Farm.
Let's do
And
it.
they were doing the same thing. They were doing pigs out in the forest and supposedly taste really, really good. So that's, and I don't eat a lot of pork. I eat pork very occasionally, and usually it's a piece of bacon here and there. So I would
Right.
definitely be, if I was going to eat more pork, I would definitely, prefer to do it that way, I think.
Hmm. Yeah, I'd recommend it.
So as far as, so the new stuff with the company that you're with, I mean, it's kind of interesting because you and I are both CMOs of tech startup healthcare companies, both in the Air Force, both
Right.
like to live, both do kind of carnivorous diets. So it's kind of, we have a lot of similarities here. Um, where do you see your role with that as a CMO? I mean, what are you trying to achieve with that? Are you trying to get, um, I mean, is it something you would add on to someone else's practice, or would it be standalone practices? I mean, you mentioned it'd be standalone, but what is the goal here?
The I mean, some of it I'm still kind of trying to work that out, but I would say the big vision of Osmind is to enable mental health practitioners to be independent. So that's kind of what I see. Like that's what I see now as my leadership platform. That with if you're a psychiatrist or a nurse practitioner, and Osmind provides the practical tools, right? The RCM, the full suite electronic health record, everything you need. But the major point is that there's no reason to ever go work for a larger system if you're a independent practitioner that uses Osmind. Now, clinically speaking, I think then it's, if I may be so bold, I would say the elevation of psychiatric practice across the board is the truth of the matter is a absurd number of my colleagues are still just slinging drugs all day, and that's like literally all they do. So we call it medication management as a form of practice, but it basically boils down to seeing 4 patients an hour all day, every day, writing prescriptions as fast as you can. And, the antidepressant drugs, they have a success rate of about 30-ish%. So what are you really doing? Right. It's like only in baseball and psychiatry is a 300 batting average considered good. And if all you ever do is write drugs, when now in 2025 psychiatry, we have TMS, we have ketamine, we have esketamine, we actually have a couple oral medications that are now considered novel. If you got the reading skills and the guts to move away from serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and within the next couple of years, we expect to have access to like one or more of the emerging psychedelic treatments, and that MDMA, psilocybin, DMT, a variety of versions of all of those things that may or may not be patentable. Being able to put those things into your practice as a psychiatrist is going to involve not just an understanding of the medicine, but a better understanding of real estate, right? If you have a psilocybin treatment, it takes about 6 hours. So if someone's going to actually bring that into their practice, then you have a mental health clinician who has to rethink the whole flow of their business. If you're going to start bringing in 6 hour treatments, and the big vision of Osmind, and like my vision as a chief medical officer, is also to be a part of facilitating that, so that we can actually start getting people better, right? That the CDC number these days, there are about 60-ish million people in the country believed to have a greater than 0 degree of mental illness. There are, the most optimistic estimate I can find, there are maybe 70,000 psychiatrists and psychiatric nurse practitioners put together. So if the number, and that number is probably going to go down, not up, right? The more than half of American psychiatric professions over 55. So where there's nowhere near enough in the training pipeline to keep our numbers from falling off a cliff. So
Yeah.
if
I
we
think if they
think
just
we're going
want
to do that, what?
Well, I was going to say if the goal is just to hand out drugs, just do a bunch of SSRIs and the selective serotonin norepinephrine inhibitors, reuptake inhibitors, rather than, I mean, you can literally do that with AI. I mean, you're going to see that. I mean, you're going to
That
see.
too, right?
I mean, there's legislation in the House of Representatives to allow AI to have a medical license, which is, in my view, somewhat concerning.
Well, what's the application fee if you're an AI? Like that's the real question, right? What do you have to pay the state to get that license? That's what I want to know. But when I'm feeling, I agree with you 100%. When I'm feeling particularly provocative and confrontational, and any one of my colleagues starts to get a little bit upset about AI, I'm like, if you want to be replaced by AI, keep doing what you're doing because you're right. And AI can sling drugs way faster than a human being,
and more cheaply, and
more cheaply,
they
and
don't.
there'll be
The
less
pharmaceutical
crime
companies
about.
they don't need to bring lunch to your office or
That's
take you to
exactly right.
conferences or bring you to fancy dinners. They can just say, "Hey, look, we'll just have the AI do it for free."
Yeah, they don't whine about prior auth. It's like
Yep.
all that crap. That's exactly right. So that if you want to be the kind of professional that's special and probably can't be replaced by an AI, then yeah, you got to
Yep.
do. People call it interventional psychiatry, and I don't disagree with that. And the wonderful people that hired me at Osmind almost seem to think I might have been the first one to say that, right? Because I founded Virginia Interventional Psychiatry like 13 years ago, and they're not sure that someone did that before I did it. So maybe it was me, but I really prefer. This is also part of like where I'm coming from now in my role. I think of interventional as full suite psychiatry. Like you're a psychiatrist. You should be able to do everything a psychiatrist can do. And that means interventions, that means medications, that means therapy, that means like literally everything that we should be capable of doing based on our training. Like what if you were a surgeon, but you literally only ever did one thing? It's like, well then congratulations, but you're awfully limited. The slice of people you can help is pretty darn small.
Yeah, I mean, there's a few guys like that where they're like, they do only a specific, minimally invasive this procedure, and people from all over the world travel to see them. But again, yeah, you're really limited. And like I said, as an orthopedic surgeon, I mean, I took, I had a psychiatry rotation in medical school, and we did a little bit of that stuff. But I mean, but now every day I see people with psychiatric conditions get better just by fixing their diets.
Yeah.
And it's so, as you mentioned, it's such a common condition that most of the people I treat, a significant percentage of them will have some sort of, whether it's depression, anxiety, bipolar disorder, or something going on, ADHD or ADHD or something like that. It's so common. And I don't know if the incidence is still increasing, but it certainly has over the last half century. I don't know if it's still on an upward trajectory. Perhaps it still is.
I think it is, but now that you got me ranting, it's like if you're a psychiatrist and you won't participate in everything a psychiatrist can do, then I don't think you're really being a psychiatrist. But if you're a psychiatrist and you don't pay attention to someone's metabolic health, then I don't think you're being a doctor, right? Like that, I don't, I work on brains, like that's what my specialty is, but I can't forget that the brain is dependent on every other system in the body. And which actually is why, Chris Palmer's book was such an epiphany, because if your insulin's not right and your fuel system's not right, then, there's no logical way that the brain can be right. That's just kind of going all the way back to one of your initial questions that heck yes, I think TMS will be enhanced by fixing someone's metabolic health first, because that if I'm trying to stimulate a brain to make it work better, I don't really think that's possible if the brain can't really get enough fuel.
Yeah, that's a pretty fair assessment, I think. Well, we've got just a couple minutes left. Will, anything else you want to touch on real quick before we go?
Well, I wanted to go all the way back because you mentioned kwashiorkor.
Mm-hmm.
And speaking of being a doctor, I did want to tell you that last year I legit diagnosed someone with kwashiorkor in the clinic.
Wow.
That is a thing that happens.
What were they doing? What were they on? Were they?
Of course, this poor unfortunate person came to me because she was depressed. But then she started telling me half of her depression had to do with the fact that she lost all her toenails. And I am not kidding. She was told that she was walking too much. So someone's like, well, maybe you shouldn't be walking so much if you can't keep toenails attached. And the real answer, talk about like just being a doctor. This poor lady had a Roux-en-Y maybe 10-ish years ago. And, it did what it was supposed to do. She probably lost 50, 60, 70 pounds, when she got that. So she went from being like very, very obese to being a lot less obese. And I'm sure that helped a lot with, some of the danger associated with how obese she had been. But honest to goodness, the whole conversation I had with her, I don't think anybody ever explained to her that she absorbed nutrients probably a fraction what she did before. So the poor thing is trying to follow practically a plant-based diet, right? She's eating a metric ton of fiber. She's not eating enough protein as it is. But then with the Roux-en-Y, 10 years later, I might have been the first person to tell her that with what you're absorbing, there's no logical way you're getting more than probably a quarter of the protein your body needs. It's not even close. And had to have the whole conversation that, she shouldn't, frankly, I advise carnivore because I'm like, you can't be filling up on junk. You have no room for fiber. It's like every single bite you eat needs to be as valuable as humanly possible because it's so difficult for you to eat real volume and it's difficult for you to absorb what you do eat. So she did great with TMS, but honest to goodness, I think just eating real food went a long way to like help her depression. Plus she was particularly delighted when she did get her toenails back. So the toenails started growing in and staying, her hair. She was losing her hair. She's losing toenails. I mean, everything that goes with kwashiorkor.
Yeah, so it's been. I remember I lost my toenails, but it was due to trauma because when I climbed Mount Kilimanjaro years ago in year 2000 on the way down, I didn't clip them short enough, so they were slamming into my boots repeatedly, and it basically just broke them loose. And that was a lot of fun. I took my boots off at the bottom of the hill, and my feet were covered in blood, and like 7 toenails were gone. So that was a sucky few months as they grew back in, but. Well, thank you for doing what you do, doing this, and thanks for doing what you do in general. And I look forward to hearing how things go down the road. If anybody's interested in what you're doing or the company, can you share those details?
Yeah, the company is Osmind. Think of it like Osmind, operating system of the mind. So osmind.org. So that's that's the website. That's the whole company. If someone wants to find me in particular, William Sauvé, Sauve on LinkedIn, and then first name, last name, William.Sauve at osmind.org. And come to me directly. And we have a big forum, the Psychiatry Collective. We're approaching 3,000 members now. So go to Osmind. You can find the Psychiatry Collective. And if people want to get in there and shoot the breeze about all things mental health, join that forum. And I post in there every day. So they'll find me.
Awesome. Well, if I ever get out to Virginia, I'd love to come check out your emu farm and go hit a workout with you and something like that. That'd be fun. So
heck yeah, we'll make brisket and then we'll go visit Joel.
That sounds good. All right. Thank you so much. Well, take care.